Hello everyone, this is Simran Chaudhary and I welcome you all on behalf of Voice of Healthcare to the fourth edition of National Cancer Conclave Uniting for Closing the Care Gap supported by AstraZeneca. And for today's session, we have our guest Dr. Manasi Shah, who is a consultant oncologist, SGVP Holistic Hospital, Ahmedabad. Welcome Dr. Shah, it's a pleasure to host you.
Thank you so much for having me on the show. It's a pleasure to be here.
Yes, and we are looking forward for this session to know more about you from the doctor's perspective about cancer awareness. As you know, the February month is National Cancer Prevention Month, and there's lot more to know to discuss about cancer, its sides, its symptoms, and how does it affect the family, the person, and the journey behind it. Because we all know how deadly is cancer for everyone, even for the person and to the family and to the loved ones who all are connected to that person.
Sure, sure.
Yeah. So, Dr. Shah, we just want to know, like, we are going towards in the depth of cancer and stuff, and we know there are many types of cancer which we are not all aware about, right? So, there's one type of cancer we don't people don't know about it outside in the world. That is the endometrial cancer. So, we would like to discuss this about in today's session, like navigating endometrial cancer, patients' insights, and treatment advancements. So, this is the topic of our session today.
That's great. I think a lot of awareness needs to go in all these what we also call less commonly talked cancers. So I'm glad that you're bringing this up today.
Yes, even from a layman's person perspective, even I want to know more about it because you are doctor, you are from the medical fraternity, and you are the best person to get to know from this.
Sure,
Yeah.
we can get started.
So yes, Dr. Shah, I have so many questions around my head right now. Like, what is endometrial cancer? What is the prevalent rate of cancer in our India? Like, how many cases do you go through every day in your sessions or the patients you see every day? So we just want to know everything about it.
Okay, so we'll start off. First of all, endometrial cancer, that is cancer of the uterus. What is uterus? I think most of us would probably know. It is small organ which is there in the pelvis, so lower part of the abdomen, which when pregnant, that is where the fetus is born, and that is where pregnancy takes place. So that is a very vital organ for every female and the reproductive system. So if we can show the figure so that you'd be
Yes,
able to understand in terms of the anatomy. So the uterus has two layers. There is an inner layer which is called the endometrium, and an outer layer which is the muscle of the uterus, and it is called the myometrium. So when we talk about uterine cancers, it is an abnormal growth of cells that occurs in the mainly from the inner lining of the uterus, and that is called uterine cancer or endometrial cancer. That is the most common type of cancer. There
yes.
are common types of uterine cancers called sarcomas. They start from the muscle part of the
Hmm.
uterus. So majority of our talk here today will be talking about endometrial cancer. That is the pink lining that you see on the inside of the uterus.
Yeah.
In terms of how common it is, so if we talk about female cancers, cancers that occur in women,
Hmm.
the most common cancer, as we all know, is breast cancer. Then there is cervical cancer. Cervix is the portion which is below the uterus.
Yeah.
And then, depending on which part of India you're from, oral cancers and lung cancers, and ovary cancer and endometrial cancer. So, endometrial cancers accounts for about 4% of all female cancers, which might seem like a small number, but when you talk about just the female genital system, it is the fourth most common. In 2020, there were about 16,000 new cases of endometrial cancer in India,
Okay.
and this is something that it is increasing. See, as westernization is increasing, breast cancer is increasing, endometrial cancer also has a lot of hormonal risk factors, and that is also increasing in number as we are embracing a different lifestyle, as we are embracing more sedentary lifestyle, where there are increased chances of having being overweight or obese. So all these factors are causing endometrial cancer to be on the rise.
Yeah. And how many patients do you see across daily who comes to you for this endometrial cancer? And if I specifically talk about the stage 3 and 4, that is the advanced stage we call.
So, in terms of, thankfully, we'll talk about the signs and symptoms soon, but thankfully, endometrial cancer can be picked up early if the female is very vigilant about the symptoms. So, unlike a lot of other cancers, we do see a lot of stage 1, stage 2 endometrial cancers, and stage 3, stage 4 are usually when you have neglected the symptoms for very long. So, it is
Hmm.
more common early stage endometrial cancers compared to later stage endometrial cancers. And in the clinics, we would say, we would see one or two new cases every week. So it is not as common as breast or cervix, where we see new patients every single day.
Hmm.
Thankfully, this is still on the lower side, but we see one or two new patients every single week. Yeah.
I think, like you said, you see every one or two patient every week. This makes me realize the rate is very high, and we all are not aware about it. You in a person see that, and there's so many other hospitals, other doctors, they would also witness the same thing. So the rate is very high, I believe that way.
Yeah. No, like I
So
said, it is.
yeah, you were saying something, doctor?
No, no, sorry. You can go ahead.
Yeah. So, like we were talking about the signs and symptoms and how important it is to be, vigilant about like when to come to a doctor for evaluation, for testing and all. So, how do a normal person should decide that this is the right time to go to a doctor? Like, what are the common signs and symptoms a person can, witness at an early stage of cancer, and the common signs and symptoms at a later stage, that is the advanced stage of endometrial cancer.
So, as we all know, the uterus is where the menstrual bleeding takes place, because the uterus lining, it gets shed every
Hmm.
month.
Hmm.
How ovulation happens. So, uterine cancer is normally a disease of the elderly women. So, majority of the women are diagnosed after the age of 50,
Okay.
and by the time you're 50, most women will enter menopause. So they will
Yeah.
have stopped their normal period. So
Hmm.
one of the most common symptoms of endometrial cancer is abnormal vaginal bleeding. If you
Okay.
are menopause and you notice even spotting or even
Yeah.
one day, then it should not be taken lightly. It should
Hmm.
not happen. And even with one episode, you should go to the doctor and get yourself checked. If you was, if you're having your periods but you notice that the amount is more, or if it is becoming more frequent, or say if it doesn't stop for 15 days or 10 days, and you feel that this is not your normal pattern of menstrual cycle,
Yeah.
then again you should go to the gynecologist and get evaluated. Not every abnormal vaginal bleeding is going to be endometrial cancer, but there is a chance that this might be the first symptom. And so, whatever the reason might be, you need to see the gynecologist. In
Yeah.
terms, so for early stage cancer, usually the only symptom is abnormal bleeding. In terms of advanced stage, because when we talk about advanced stage, the cancer has spread from the uterus to, say, surrounding organs like the urinary bladder or the rectum, or in some cases the lungs. Then you will have symptoms which involve pain, so pelvic pain, back pain, again bleeding will still be there. and you can notice abdominal bloating. So you feel like your stomach is very heavy. And in very advanced cases, if the cancer has spread to other organs like the lungs, then you might have a lot of coughing or shortness of breath, depending on what organ it has spread to. So these are some of the symptoms of advanced stage disease.
Correct. And like you said, doctor, how the westernization is increasing in our country, and that way the lifestyle is changing, the diet is changing, and the kind of stress everyone is having right now, it also does affect our cycle, our pattern of menstrual cycle. So that make an people sometimes avoid. If I talk about myself, so yes, even I feel like it could be because of stress, it could be about my poor diet and stuff like that. So that way we all ignore all those signs and symptoms, but yet it is very necessary whenever you feel the changes is there, the cycle is changing, something abnormal is going on. Even just to be on a safer side, it's better to go and consult your gynecologist, and then
Correct.
they'll tell you ki whether this is just a stress, your lifestyle, or is it's something serious. So never to be
Correct.
your own doctor, and always consult a gynecologist.
Correct. Correct. You said it very well.
Yeah.
Because
So
endometrial,
yeah.
80% of all endometrial cancers are driven by estrogen, the female hormone.
Hmm. Yeah.
So, there is an imbalance in the estrogen hormone. It can affect the uterus lining, which is why there are all these irregularities in the menstrual cycle. So,
Hmm.
if there is constant estrogen exposure, it does affect the uterus lining, and sometimes, not always, like you said, sometimes that can lead to cancer.
Yeah. So, doctor, my next question would be, since the topic is very, is bringing so many questions out of me, and there's, I believe, I'm being a kind of that bacha in the class जिसके दिमाग में इतने questions आ रहे हैं, I'm not able to stop myself from knowing much about endometrial cancer from you. Is that see, we all know how difficult it is when a person is diagnosed with cancer, and that how traumatizing it is for that person, for the family, and for everyone. So what is the journey of a person who is diagnosed with endometrial cancer? And please help us about to understand more about it, because you see it, you go through them, you treat them. So how does it feel, and what does the journey look like? And
So,
will also be better if you can guide us through the PPT that we are sharing on the screen, if
sure. So,
there's
if
something.
back of 2, 3 slides, there
Yeah.
is a slide in pelvic examination, and then we can go from there. So usually when a patient comes in, either to the gynecologist or to the gynec oncologist, and they complain of this abnormal vaginal bleeding,
Hmm.
um, a stepwise approach. We of course take a very good history in terms of what are the risk factors, if there is any family history, because about 5 to 10% of endometrial cancers can run in the family. And then we have the examination part. So if you can go back a few slides, there is a slide about pelvic examination in the
Okay.
PowerPoint, where the gynecologist will examine the inside of the vagina and
This one?
the uh, yeah, you can keep this. This is a
No.
speculum examination. The previous one actually.
Okay, just a second.
Yeah, so this is where you go to the gynecologist and you have to lie down, and they manually examine you with both hands. And as you can see, the hand is in the vagina and the lower part of the uterus, and the
Hmm.
other hand top of the lower abdomen. Basically,
Hmm.
this is trying to feel if there is any abnormal growth or if there is any abnormal bleeding that is coming from the lower part of the uterus. So if you go to the next slide, then they'll do a speculum examination where they put in an instrument and
Hmm.
they take a from the lower part of the uterus, and sometimes we can find some abnormal cells there. Next slide. And then after that, to look inside the uterus, we have an ultrasound that we do, which looks at the from the ultrasound you can see if there is any abnormality in the uterine lining or how thick it is. Usually when there is cancer, there should be thickening, if not a
Okay.
growth. And then they try to scoop out a part of the
Okay.
lining. So
Hmm.
when you scoop out, you see some abnormal cells, and then you send it to the laboratory, and the pathologist will tell you whether this is just normal hormonal imbalance or if there is any evidence of cancer. So usually these are the common basic tests that we do in the office. Now,
Okay.
if there abnormality, suspicion of cancer, then the next step we do is biopsy, and the
Hmm.
biopsy again is can be done in the office or under local anesthesia, which will confirm whether there is cancer or not. I can go to the next slide, which tells you about the staging. So, like I said, if we are vigilant and if we go to the doctor early enough, most of the endometrial cancers are diagnosed in the early stage. So there are four stages of endometrial cancer: one, two, three, four. One being the earliest, and fourth being the most advanced. If
Yeah.
uh, for the first stage endometrial cancer, basically it is limited only to the lining of the endometrium, or maybe it has gone a little bit inside the muscle.
Hmm.
For the stage, it's in the next slide. For the second stage, the cancer might have spread a little bit below the uterus into the cervix, but it is
Hmm.
still to the organ itself. The
Yeah.
third is stage three. So three is again divided into A, B, C,
Yeah.
and stage 3A would be if it has spread a little bit outside or to the ovaries. Stage 3B is if it has gone down to the vagina and a lot more outside. So in the outside, there are outside of the uterus, there are the urinary tubes which come down. Sometimes it can affect urination also.
Hmm.
Um, Stage 3B and stage 3C is when it has spread to the lymph nodes. So it has gone up in the abdomen. So that is, I think
Yeah.
you look at the slides and you'll see the 3C. Next one. And then if it then the locally advanced or the advanced, it is it has spread to the, as you can see, the uterus behind there is the uh, part of the large intestine, the rectum
Hmm.
where you pass your stool, and before the uterus is the urinary bladder where you pass the urine. It's a
Hmm.
small space. You can
Yeah.
see everything of confined to one space. So as there is more advanced disease, as the disease spreads out, you can have difficulty in passing urine, you can have difficulty in passing stool, you can have pain there. So basically, how do we decide whether the patient is early stage or late stage?
Hmm.
This is done with the help of scans, imaging. So either we can do a CT scan of the abdomen and the pelvis, or we can do an MRI of the pelvis, either one of the two, depending on what we are seeing on a physical examination. But we decided through imaging studies. And if we feel that the disease has spread outside the uterus, then we also make sure that so we normally do a whole body CT scan to decide what the stage of the disease. So first step is examination. Second step is biopsy. When the cancer is confirmed, then we ask for CT scans or MRI. And once we know what the stage of the disease is, we can explain to the patient or explain to the relatives, is it curable? If it is
Hmm.
curable, then what do we need to do to cure it? And if it is stage one, stage two, or even stage three, the first thing that usually happens is we want to take it out. So we want to do a
Yeah.
surgery. And when you do a surgery, you have to remove not only the uterus, but you also have to remove the cervix, a part of the vagina, ovaries, because you can never be 100% sure. Sometimes there might be small cells that you miss out on your
Hmm.
CT scan. So you need to remove the whole thing, and this is done by an expert. So we have expert gynec onco surgeons who deal only with gynec malignancies. It is very important to understand that a normal gynecologist, we know with experience, they can maybe do this surgery, but in terms of qualifications, there are gynec oncosurgeons who learn extra, they go through an extra training of 2 years, 3 years. just to
Hmm.
master this skill. And a lot of times what happens is, sometimes there is an abnormal vaginal bleeding, and maybe the patient is in an area where they don't have access to scans or these MRI machines, and they just get the uterus out. Now when they
Hmm.
get the uterus, now we know that there is cancer. So the patient has already gone through one surgery, and now they have to go to
Hmm.
another, just to make sure that we got everything out.
Everything out.
So
Yeah.
it is very also important to remember that if you have this bleeding, and if somebody says just get your uterus out, then that's not how we normally do it now, because we need to know why there is this abnormal bleeding. So you have to go through these steps,
Yeah.
and or it was just simple, just take the uterus out and that's it. But now we know that that is not the correct way to go about things. And so surgery is one part. And then, like I said, stage one, stage two, where the disease is only limited to the uterus, sometimes you might need radiation.
Hmm.
And for stage four, most of the times you will need surgery, chemotherapy, radiation therapy. And for stage four, you need chemotherapy and some other medications that we'll talk about. But the most important thing to remember is, if you are having abnormal vaginal bleeding, the reflex should not be take out the uterus. The reflex should be, we should try and find out why, and then you go step by step.
And like you said, Dr. Shah, that how does it impact the journey? How it starts from one place to, and then it grows and it starts affecting the other places, other organs, and it's spread, and then it becomes very difficult for the person, the pelvic pain and stuff, and for the doctors also to get diagnosed it, and to remove all the cancer cells inside from the body, and how difficult it is. So I believe it is the similar, since you're a doctor and the surgeons, gynecologist, everyone knows about the complication about it. But what about from the patient's perspective? How do they go through it? How do you guys make them understand? And especially the family, because I know this ये आप लोगों का काम है, and you can understand it very well. But from my head, I'm just getting this thought कि वो लोग कैसे समझते होंगे इस चीजों को.
So normally, we have multiple consultations with the patient.
Yeah.
They all meet all the relevant doctors that are going to be involved in their care.
Hmm.
So in the treatment now, we have, like I said, surgery with the surgical oncologist does, radiation with the radiation oncologist does, and the medicines, newer medications that medical oncologists like us do. So we usually have a team approach, and the patient will meet all these three doctors if all these three treatments are required at the initial plan.
Hmm.
We always the patient come in with two or three relatives, because the first visit is only telling them that they have cancer. And
Yeah.
by the patient hears the word cancer, then the patient might not be able to understand everything else that we're going to say next. So that is
Correct.
why having family members or friends, whoever you rely on to make medical decisions with, they have to be there at the meeting, so that at least they can understand some of the things. And then at that time, we'll also give them some written information, to so that they can go home and absorb everything.
Yeah.
And patients want to understand everything in the first meeting. Some patients want to come back, say next day, to kind of go through the whole treatment plan. So apart from doctors, we also try and encourage the patient and the caregiver to meet like a counselor,
Hmm.
um, um, psychologist, not a psychiatrist, a psychologist in our team, who goes through a lot of other aspects of the patient's life. What is the social support system? What is their educational background? What are their expectations out of this whole thing? And if it is early stage, or if it is a curable disease, say one, two,
Hmm.
three are cured, then that also gives them hope.
Hmm.
And it is a whole process. And I think we also tell patients that when you're stepping in into the unknown, say we tell the patient you have to go through surgery, they have a lot of questions about that, then radiation, then chemotherapy. So every step, whenever you're stepping into the unknown, it brings a lot of anxiety, it brings a lot of fear. But
Hmm.
as kind of get into the treatment process, they realize that, this is how their body is responding, and they find the courage in them to
Mm.
get to the end of the tunnel, because there is light at the end of the tunnel.
Yeah.
And it is a complex process. There are a lot of people involved in the process to help the patient as well as the caregivers, because the whole burden also lies on the caregivers to make sure that the patient has enough support. um, so yeah, I think it requires a lot of counseling and multiple consultations before we start treatment. The other thing I want to tell is, see, these cancers, they do not happen overnight. It
Hmm.
usually takes months
Yeah.
for you to a place where you have cancer, sometimes even years. So we do not encourage patients that, okay, you've come for this visit with all these reports and we're going to start treatment today or tomorrow. We give the patient time to think over things and to go through the whole process of accepting the fact, and then start treatment. So I also want to tell that cancer treatment, like, a lot of patients and the families think that, oh, I'm diagnosed with cancer, I need to get it out tomorrow.
Yeah.
It is not. You have to take the time to do the necessary tests, to get the test reports back, then go through the process.
And I believe you guys are doing it in the right way, the right process, and touching the right nerves. Like how difficult it is a person to adjust if he or she has diagnosed with cancer, and how many stages the person goes through, whether it's the mental trauma, it's emotional thing that they have to believe that they have diagnosed with it. And the process you have just explained is very necessary, I believe, just to make them understand and believe and have that trust of the patient. You are in the right hands, and don't worry, the treatments will work. And once they start believing it, actually it starts working. And the light is out there, the sunshine is अंधेरी रात के बाद सवेरा जरूर है.
Correct.
Yeah. So, Dr. Mansi, we would also like to understand about the advanced treatments, that can help us to reduce the progression of endometrial cancer, especially in the advanced stages. Like, and what are the steps doctors follow for the treatment at early stage and then later to the advanced stage?
So in the early stage, what the advances that we have in terms of surgical advances, this surgery can be done robotically,
Hmm.
so that you don't need that whole scar in your entire abdomen.
Hmm.
You just 4 small holes through which the doctor can go in and remove everything. So that is called robotic surgery or laparoscopic surgery.
Okay.
It reduces time to recovery in the hospital by day 3 or day 4. Complications rates are less. In terms of advances in radiation therapy, which is again used in stage 1, stage 2, and stage 3, you have much better machines so that you can give targeted radiation only where you want to give, and try to avoid the spillover effect, like you saw in that image, that there is the rectum, the
Hmm.
intestine adder, which is like next to it, right next to it. So you want to make sure that you're not damaging all those organs. So that comes with better machines,
Okay.
better technology. And then in terms of advanced cancer, so like you're seeing in this picture, the tumor grows in the pelvis, and then it can spread through the lymphatics or the blood channels anywhere in the liver, in the lungs, most commonly, or in the bones sometimes.
Hmm.
So you to have medications that will decrease the cancer growth in all these places in your body, wherever it is. So the most common treatments are chemotherapy, as we all know.
Hmm.
Chemotherapy, the most common side effects is hair loss, which we worry about. So we have the advancement is that you have a scalp cooling device, which
Hmm.
is uh, a cap, which is
Okay.
kept cold. It is attached to a machine, and that cap is kept cold at around 4 to 8 degrees Celsius. And so that prevents the chemotherapy induced damage to the hair follicles, so that the hair, not 100% of hair loss does not happen. Uh, you still have 50 to 70% of your hair by the time you complete your chemotherapy treatment. So that is one advance, is to avoid chemo induced hair loss. And in terms of the medications per se, other than chemotherapy, you have a lot of targeted therapies. So, like we say that if um, not every human being is the same, right?
Hmm. Hmm.
Every tumor is the same. So even stage 1 endometrial cancers is like a human being, and there will be a lot of different types of stage 1 cancers.
Yeah.
Not everyone is shy, not everyone is angry. So, like that, the tumor also, the behavior of the tumor is also very different.
Yeah.
So you have targeted treatments. So you find out how this tumor is behaving and then you give a specific treatment. So for that, you do a lot of genetic testing on the tumor per se. You have to see what drives this tumor. And then, for example, if you have a tumor that is HER2 positive, it is a type of protein on the cell, then you can block that HER2 protein with a HER2 targeted agent. If you see that the tumor is sensitive to immunotherapy,
Yeah.
then you give immunotherapy. That is the latest advance in endometrial cancer,
Hmm.
where you use your own immune system to fight the cancer cells. So that is effective in about 25 to 45% of patients. So these are all the advances, and the basic thing is that you are individualizing treatment. You are not treating
Hmm.
all patients the same. Chemotherapy usually works in everyone, but then you have hormonal therapy, targeted therapy, immunotherapy, for which you have to do specific tests to find out whether this medicine will work or not. So I think the advancement is in trying to figure out how your tumor is behaving, what is driving the tumor, and then picking a specific medicine for it.
Yeah. And is the treatment pathways the same for the advanced stage cancer, or it is a bit different in this case?
Advanced cancer treatment is different
Okay.
than the early stage cancer. So stage 1, 2, 3, the treatment is different because it will also involve removing the uterus. It will also involve giving radiation. Whereas in
Hmm.
stage 4, because the cancer has already spread from that particular part and it is like a lot of different places, you cannot go and remove everything. You cannot go and radiate everything. So you
Yeah.
need medicine. So the treatment is different.
Okay. So the treatment pathways for the early stage cancers and later stage cancer is different, and it all depends upon the testing and the diagnosis, and especially from the targeted area. So, Dr. Shah, there's one term I believe we have the person who is into this field know about is that is the biomarker testing. And we just want to know what it is, how does it impact the diagnosis, how it impacts the treatment, and how it helps you and the patient, to get rid of this endometrial cancer or make the journey bit easier for them.
So biomarker, we have, like we talked about, is the biology of the tumor. That is what we're trying to understand. What is the nature
Okay.
of the tumor? So, in terms of biomarker testing, we do it routinely for stage 4 patients or advanced cancer patients, because, like I said, we have specific treatments for specific patients. So, this is biomarker driven. Biomarker, it's a marker of the tumor biology. So,
Okay.
ये हार्मोन देना है, टैबलेट्स देनी है, ये पेशेंट को कीमो देनी है, ये पेशेंट को इम्यूनो देनी है, दैट इज ऑल बायोमार्कर ड्रिवन. सो ऑल
Hmm.
पेशेंट्स विद stage cancers get these tests done, including
Hmm.
genetic tests. And the research is ongoing for stage 1, stage 2, stage 3. We know that not all stage 1 cancers, there are 90% cure rates with stage 1 cancer, but we're trying
Hmm.
to find out at least 10% relapse, recur, even if they're stage 1.
Yeah.
So we are biomarker testings, which is basically genetic testing. There's a lot of complex genetic mutations that go into every tumor. So we're trying to figure out which mutations cause the cancer to come back. But that is still in the research phase. There are certain markers that we're doing currently called the MMR or the pole E, which helps us figure out which patients will do better.
Hmm.
Uh, Patients. So it is. There are three biomarkers that we do routinely for all patients: MMR, poly, and P53. So it's a complicated algorithm, but it helps us at least give the patient a prognosis. Are you good risk? Are you bad risk? And then if you're
Okay.
bad, we might want to treat you a little bit differently. But again, I think it'll take a year or two to kind of come to a conclusion in terms of how best to give patients treatment. Because we also don't want to give everyone chemotherapy and radiation therapy. If we know that
Yeah.
this patient is going to behave well, and the cure rate with surgery alone is more than 95%, then we don't want to give all these additional treatments. So this research will help us determine who we can give less treatment and who we need to give more treatment.
Yeah.
I think we'll come to know in the next few years.
So in this case, like the kind of treatment biomarker testing helps you to decide which patients wants which kind of treatments that way.
Correct.
And when do you decide that now we have to go for this biomarker testing?
So technically, right now, at least in the institution that we work in, and in all academic institutions throughout the country or the world, the biomarker testing is offered to 100% of stage 4 patients. And for stage 1, 2, and 3 patients, we counsel the patients
Okay.
that this is important to it. It helps us prognosticate what is your risk of recurrence. And then, so we offer it to all our patients, but it is definitely done for every patient who has advanced disease.
Okay, that's great. So, Dr. Shah, there's another question coming in my mind. I believe that was supposed to be discussed earlier, but now we were talking about the diagnosis and treatments. So, I just want to know the risk and causes of this endometrial cancer and the person, those who are more prone to this. How do we, get into the phase or think, ki, acha, if we'll do this or we have to modify this, something is there which can, make us to this side of being an endometrial cancer patient or that way.
So in terms of the risk factors, most of the endometrial cancers, like I said, are estrogen driven, hormonal driven. In terms of risk factors, obesity is one of the risk factors. Increasing age is one of the risk factors, which we cannot modify, of course. If you're taking a lot of estrogen supplements without any progesterone supplements, estrogen alone is a risk factor. There are certain gynecological conditions like polycystic ovarian disease, which releases a lot of estrogen, which can sometimes increase your risk for developing an endometrial cancer. And like I said, about 5% of all endometrial cancers can be hereditary. So if you have family members with endometrial cancer, multiple members in the family, or sometimes intestinal cancer and endometrial cancer and breast cancer run in the family. So if you have a strong family history for cancers, then we do have a blood test which is available, which will tell you whether this is hereditary or not. So you can get that blood test done, and if it comes back positive, then we have to uh, deal with it accordingly. So these are some of the risk factors. So what we can do, like it is true for all diseases including endometrial cancer, is to maintain a normal body weight, to um, avoid a lot of the processed food and the junk food, because it increases the incidence of diabetes is also a risk factor for developing endometrial cancer,
Yeah.
because it affects the hormones. Um, so basically, going back to your lifestyle which your grandparents had is probably the best thing that you can do. And also, if you've never had children, that is a risk factor for developing endometrial cancer. So these are some of the risk factors, and you can modify them accordingly.
And like you said, if a person has the history of cancers in his blood, so is it specifically the endometrial cancer or any type of cancer in the family history that blood test helps them doctors to analyze about it?
Any kind of cancer in the family, but usually there are syndromes. There are,
Okay.
like I said, cancer, intestinal cancer, breast cancer. That is a
Hmm.
syndrome called, so you have specific mutations for that. So there are
Hmm.
specific syndromes that can run in the family. It's very difficult for a layperson to decide, So I think any strong family history of breast cancer, of any cancer, say if you have one or more relatives within the family with a history of cancer, then at least it is worth discussing with your oncologist to see where, if you need to get the test done or not. If you're 80 years old and nobody in your family has had cancer, only one person has had some lung cancer or something, then you're not at an increased risk. So there is, I think it is worth discussing with your doctor. And one of the biomarkers that I was talking about, the MMR, that we routinely do now for almost all of our patients, is an indirect hint whether you have hereditary cancer or not, also.
Oh, yeah. Dr. Shah, this answer has helped a lot of listeners out there, to get them understand whether they have to go for these kind of testing or not, whether they are, more open up for the cancer diagnosis, or the chance of getting it into getting the cancer. So it's always better to be aware, take preventive measures rather than to be a patient.
Correct. Prevention is always better than cure.
Prevention is always better, and that's why we all are celebrating this National Cancer Prevention Month
No,
this way.
it's a great thing that you guys are doing. Also this is promoting people to come out and talk more about their health issues, whatever they might be,
Hmm.
because we open about talking about our health issues, let alone gynec issues. A
Yeah.
lot of people in a social taboos in terms of talking about this. So I think it's a great thing that you're doing it.
Yes, and you know what motivated us? The lack of education about women's health. Only the women, matlab, even women are not aware about it, and that's why it motivated us to take this initiative about talking about various cancers, specifically about this endometrial cancer, which is not much known, not much talked about it, and so that how we can be more aware about it, what are the causes, symptoms, risk factors, how can we avoid all those risks and things like that. So, doctor, we were talking about the process and treatment. So, there's always a gap in the treatment you see or absorb, right? So, is there, so that how can a patient approach for the right treatment at right point of time in the process of treatment?
So, like we talked about, the first point of contact for endometrial cancer usually is a gynecologist. So, having an experienced gynecologist at least go through the initial phases, ruling out other causes
Hmm.
of symptoms. Because, like I said, these symptoms can happen in a lot of other problems other than cancer. So, and if there's any confusion, then there are experts. There are gynec surgeons, there are gynec oncologists who can help you in this process. And just making sure that you get treatment at the right place is very important, because we don't want you to go through. Sometimes patients get misdiagnosed, or the diagnosis can be missed because we don't have good imaging or good pathologists around you.
Yeah.
So most of the places now, and this is all thanks to COVID, I think there are a lot of cancer centers that have come up in the peripheries also, like not just tier one cities. There are a lot of tier two, tier three cities who have cancer centers that have come up. I think going to a dedicated oncologist, be it an oncosurgeon or a medical oncologist, just so that they can guide treatment process, I think is very important. Yeah.
And I believe that is the right way of approach, the right pathway to follow. First going to a gynecologist and then let her or him evaluate whether everything is good or not, and then it's better if they refer, if they make it a kind of thingy, there's a risk or chance of it, so it's always better to follow the right pathway.
Correct.
Yes. And Dr. Manasi Shah, I would just like to thank you a lot because this session has made me aware a lot about it. And I believe public को तो और ज़्यादा कुछ मिला होगा, much about it, the awareness, the insights, the more about the patient's journey and how dedicatedly the medical fraternity is working towards it, to curing it, to making aware people about it, and making the process a bit less complicated and easier for them to go through this. And we all are thankful and glad for you guys for being there for us.
I would like to extend my thanks to you and your entire team for making this wonderful effort, and for getting people like us out to the public, because it is very, we cannot reach out to a lot of
Yeah.
people. We can still an individual patient, an individual family, but this also gives us a platform to reach out to a lot of people that would otherwise not be able to get here. So thank you so much. It was a pleasure.
Same here, Dr. Mansi, and you guys are doing a great job. And I know that your busy schedules doesn't allow you to go to reach the masses, to the audience, and make them aware about it. Your work is very busy. You have to treat individual person, and it's difficult for you guys to reach out to the masses. And that's why we are there to help you, to help the public out there, to make them aware about the things how they can improve their living to live a healthy and better lifestyle.
Yes, it's a team effort, like you said.
Correct, correct. Thank you
Thank
so
you.
much, Dr. Shah, for coming to the show and, you know, speaking about your experience, your journeys, and awareness about endometrial cancer. Thank you so
It's a,
much for this.
thank you.
Thank you.